This is Committee of the Wayne County Commission to order. Happy New Year to all. Madam Clerk, what's on our agenda?
Commissioner Marecki. Here. Commissioner Dobb.
Here.
Commissioner Anderson.
Here.
Commissioner Baker McCormick.
Excused.
Chair Colleen.
Yeah, I'm here.
You have a quorum present.
Excellent. We can do business. Next.
B, approval of the December 10th, 2019 meeting minutes.
Support.
It's been moved and supported. Does anybody have any additions, corrections, or changes to the minutes? Hearing none, all in favor of the motion, please say aye. Aye. Opposed? All righty. Madam Clerk.
C, unfinished business. There is none.
Well, let's blow right by that then. We got any new business?
D1, communication from the Department of Health, Human and Veteran Services forwarding the reports of the number of veterans that received the burial benefit, comparing the results for fiscal year 17-18 through 18-19.
Okay, and before we go into this, this is one of those budget instructions that we put in every year. And in the next couple of weeks, as chair of this committee, I have the list of 6 or 7 of these that are supposed to come to our committee throughout the year, and I'm going to be sitting down and talking with our fiscal people about which ones we need, which ones we don't, or do we want to add something, requirement here. So as you're looking at this report, it is some feedback that I'd like to get from committee members at some point, like, yeah, this is effective, no, it's not. Mr. Abbo, you have a comment on this?
Yeah, I did, and I was, before the meeting, I had mentioned to you, Mr. Chairman, this is the first year that we've asked for comparative information when we request this. And if you'll notice on the report, not only does it give us 2018-19, but it gives us the year before, which is an indication. Not only did we spend, the spending go up from 402,000 to 841, but it shows the resulting increase and decreases in any significant line items. So you can see that energy went up from 53,000 to 265. Shelter went from 158 to 314.
Excellent.
And burials went from 116 down to 0, and they indicate why.
Okay. And then they're projecting in the current budget year, 900,000
Spending will
of
be
expenditures.
905,000.
So that'd be another 50, 60.
The plan is next year we will ask for 3-year comparative numbers. So we'll just
Excellent.
add a year rather than deleting the prior year.
Is there anybody from veterans here today? Since you sent us a report, would you join us, please, sir? Welcome. So the whole report is that one spreadsheet. Sir, if you would give us your name and title for the record, please?
Sure. Kwesi Betsarai, Director of Veteran Services, Wayne County.
Good to see you. It's been a little while.
Yes, sir, it has.
Yeah. So we doubled this from 2017-18 to 18-19, and we're projecting to go a little higher. How is this fitting into your budget?
Well, it's fitting in nicely. I mean, we have the money. We're just making sure we're being aggressive about getting to a yes for the clients. We're being aggressive about getting the outreach plans in place, going out there spreading the word, so it's fitting out the way it's intended, is to make sure we get these monies out to veterans in Wayne County.
And is that what you're attributing the 100% increase to? Is that we've been
I would
more
say
reaching out?
It's a lot of things. It's the visibility, awareness, and education piece, but it's also a culture change and making sure the teammates understand what the vision and the mission of that department is. I don't know exactly the history before I got there, but now we're really aggressive about getting to a yes, either through our Soldier Sailor Relief or Michigan Veterans Trust Fund. So we're really being aggressive about that.
Are you able to have better lists who the veterans are in Wayne County? That we're able to contact more people because we have better knowledge of that, or?
And when you say list, what do you mean, like a
Well, I don't know. Somehow you got to know who the vets are in Wayne County.
So a lot of that comes from the outreach, going out there and telling folks about us. I mean, we have a rough estimate, 78 to 83,000 veterans, so we won't have a team going out there to call them, but you really have to get out there and let the veterans know. And so how do I envision that? It's a matter of building those relationships with the veteran service officers and those organizations all around Wayne County. And that's a big part of it.
I
is
gotcha.
Getting that knowledge out there. And then we have some other plans to make sure we get more information out there in 2020. So we should see an increase on the numbers again. And at that point, we can have some other conversations about how to tap into some other monies to help the veterans in Wayne County.
I personally, and I don't know if my colleagues, since we are wrapping up and reaching more people.
Right.
If you have a couple of stories, especially, I would imagine we have some vets that haven't been thrown out of their house because we've been able to support them,
Right.
or getting food or getting bills paid.
Yes.
If you wouldn't mind sharing a couple of those stories, because I think quite often, and I would share it through my network and my newsletters, quite often the public is, let's just say, unaware
Yes.
of what Wayne County does.
Yes.
And so the more I can help, and I'm sure my colleagues getting the word out, hey, get a hold of Veterans Department. You know, here's a couple of ways in which veterans in Wayne County can be served as a way of amplifying your message
Yes, sir.
that you're trying to do. I'd love to get something like that.
So I'll tell you a couple stories that I've, excuse me, coming off this cold, but these clients that have come through the doors. And some of those clients, one in particular was a mother of a veteran's child. So she had a dependent, she had a dependent in her household, and she was behind on her rent. And she came into our office, and we made sure that we squared that away because she was the primary caregiver. We found the monies to make sure that they were able to stay into their apartment. So for me, that was pretty neat to see that we were able to make those things happen for that family. And over the Thanksgiving holidays, right before it, we had a family come in, and she needed a lot of things. Rent was one of them. But what she was really focused on was the fact that she wasn't going to be able to provide a Thanksgiving dinner for her family. And we immediately gave that family some food vouchers so that they can provide a dinner. And we were, high-fiving each other. But when we returned from the holiday, the client sent email pictures of the turkey and it was a marshmallow casserole that the daughter wanted the mom to make. She made it every year. And because we gave her that, gave her that food voucher, she was able to provide that Thanksgiving dinner. So we're finding all kinds of ways to take care of the veterans like that. And a lot of times they'll call us and they'll tell us their stories, and we just kind of walk them through what that process requires. I'll tell you, I was in Southgate at the Downriver Community Conference where we're planning to have an outreach location. And there was a U.S. Marine. He had a bachelor's degree, but he was laid off from his job. And he came, I just happened to be at that office that day. And he told me his story and how he needed help. And it must have been, 1:30 in the afternoon. I told him, we're open till 6:30 in the evening. And he made a beeline from Southgate after he picked up his kids and came to our office at 4 o'clock. And we gave him the paperwork and got him his rent paid for, and we provided some monies for repairs on his vehicle. So had I not been there, he may not have gotten those services, may not have got that assist that he needed. So we're just trying to find out where the need is and try to meet the veterans where they live and get it to us so we can have some better stories for our veterans.
Well, that'd be great if you could share a couple, just.
I can
bring-
talk another hour. It's going to be rough.
No,
but
no,
I-
not now. But to share it with us, share it with me or whatever
I will.
through like an email.
I'd love to.
For Commissioner Baker McCormick, this is budget instruction we get annually on the expenditures over there. And what we've been talking about is, if you notice, that the amount of help we gave veterans doubled between 17 and 18 and 18 and 19. And attributing that to more aggressive outreach. So I've asked them to share a few stories with us, maybe on an email, so that we can also, through our network and through our newsletters and whatever, say, hey, there's help at Wayne County for your vets. Here's a couple. So that's where we're at. Commissioner Dobb.
Thank you, Mr. Chair. Can we get a status on the outreach I always forget
The,
the official title of this person that we're hiring.
The outreach coordinator, so that role, I believe is going to be published today or posted today. I think there's a service request and some other HR processes or paperwork that needs to be done to get that out there. But I wanted to give it some thoughtful consideration on what that person is supposed to do. All right, that person should be able to do the work that we currently do in our office, but also go out there and spread the word about what we do. So he or she should be able to coordinate events all across Wayne County, but also serve and conduct the paperwork. I would hate to send somebody out there who's just, we can do this, we can do that. Oh, but not me. I want that person to be able to execute when they meet somebody. They're able to get that paperwork started. So we had to have some thoughtful conversations about what this person should be able to do. So once we've concluded that, now we're ready to go ahead and publish that role.
Thank you. I had, excuse me, one other question. I had a meeting with Paralyzed Veterans of America, which is actually located in my district in Plymouth, and they had a suggestion. There is a pamphlet that's located on your website. It's a trifold pamphlet of, benefits that we offer, in particular the burial benefits. And he suggested that we send that out to funeral homes and even churches in the county to make that available. So when families come to bury veterans, that funeral directors or even, ministers, pastors can provide that to the families and say, if there's a veteran involved, that, Wayne County has these services available. And it's just something that they can have there to remind them to pass those on to families of veterans. So it's just a suggestion.
great idea.
I don't know, maybe we can coordinate,
do
behind the
that.
scenes, and the commissioners can maybe get involved in distributing those, or.
I like that idea because we want them to know. I had a phone call today about some services. And that part of it was similar to that, how do we get the word out? And we talked about the brochures and awareness, so I can definitely make that happen.
Okay, great. Thank you.
You're all set, Commissioner? Commissioner Anderson?
One thing to that point might be a good thing also to reach out to the individual posts. I don't know if we have an extensive list of VFWs, American Legions, the other posts that serve veterans, and make sure they get those brochures too. And I just wondered about the possibility of having a couple of attempts to pull them all together, representatives from each post, and the Veterans Department. You introduce yourself if you haven't done this already. But to take those brochures and let them know that we have these available, and we would love for you to have those on hand at the post so people see it. Because I'm getting posts all the time from a couple of the, on Facebook, I see these, that some of the posts in my district will post veterans that have passed away, veterans that are in need, as well as the activities at the posts, and it would be a good avenue to get them to maybe share information for the department too, and to get them more engaged with what Wayne County is doing for our veterans, and whether it's like I said, maybe once a year or whatever, try to get them all together and say this is something new. This is how many. I mean, they might even love to know how many veterans were buried with this tax that's placed in the county, and people are just to basically get the word out. And they're great to do that. There's some of the posts that are very active, do a lot of things for their members as well as any veteran. And
You're referring to the Soldiers and Sailors Relief Fund? Is
yes,
that- Yeah.
yeah, and the burial. This.
Well, that comes out of
is
that.
right. But I think probably the county in years past hasn't done a great job of reaching out to those different posts and letting them know about the services that are available, and to, get the information out. I think there's something in that brochure about that too, isn't there? Besides just the burial benefit, there's other services that are listed.
There's a lot of information on there. A part of it is it details who's eligibility requirements, and then it gives maybe 1 to 3 steps on what you should expect when you get there. But to go back to your part about just getting the word out to veterans, and so we're working on maybe a series of events to gather some veterans through the American Legion and other VSOs, where we'd have maybe perhaps a luncheon and we would talk about some of the issues. But we're still working on the details for that because there is a need to make sure we gather the veterans in one space that Wayne County controls, not somebody else's event, but Wayne County controls, particularly my department. So we can talk about what we offer and then also try to understand where there's some gaps. And just based on the laws, we may be able to fill those gaps, but those things that we aren't able to, then let's talk about where those resources come into play. So we're looking at a lot of things because we do want to get the word out there to as many veterans as possible.
It might be possible too to get the state to coordinate with you and for the state, this is what the state offers, this is what
Roger that, yeah,
the
that's
county,
true.
and I just think having it all together is, and maybe once or twice a year would probably be great, because they have turnover, of course, people that come and go in the leadership positions. But the other thing is, as far as information about, I know the chair had mentioned about where we get the information about where our veterans are located in the county, in Wayne County. Does the state provide any of that information, the Veteran Services for the state of Michigan? Don't they have, I think they have records that they could probably break it down to give you all of Wayne County through the state.
Now, I have some information, but I don't know exactly the source, but I can ask through the Michigan Veteran Affairs Agency if they have the most up-to-date numbers.
Okay.
I don't know if that's generated like every 10 years from the census or something like that, but we could ask for that.
Right.
Ask for that. Of
I
course,
think they
Detroit has the
do.
largest population, then Livonia, Plymouth, the downriver areas, they have larger numbers as well.
Right.
Highland Park does not have a large amount. So I've looked at those numbers.
Okay.
And I say that because whenever I go out to speak to that group of people, I like to know potentially who will be in my audience and prepare something for them uniquely for that audience.
Okay, and I believe my last question was, so as far as the position, you said they're going to be advertising for the position for
Yes,
the
sir.
Out County. Have we nailed down the locations yet? Have we got those set for when that person comes on board?
The first location that I plan to be working out of will be Southgate, the Downriver Community Conference. I've had my teammates go there November through December. We've had some positive feedback from it. That was more or less a soft rollout to understand what the scope of the work is. And then so once we get that person on staff, then we'll be able to go ahead and put him or her in that location. And ideally, it may be 2 days a week, just based on the workload. And I say 2 days a week, maybe a Tuesday. They come back to the office, do a maybe an intelligence dump or get all their documents and go back out on that Thursday so they can actually complete the homework that they know they have in our office back here, or to give the client time to do their homework to gather all their documents so we can follow up on that Thursday. So that's my tentative plan for that right now. But it will be flexible just to make sure I meet the needs of the clients there. Because we'll have all our computer work. Our part is kind of easy. So I want to make sure I meet the demands of the people downriver first. And then we'll figure out where else is there a need. Because I do not want to waste taxpayer dollars and have somebody sitting in an office 8 hours a day and no clients come in. I understand there's a lot of conversation about there's a need in this city or that city. But I want to make sure I'm a good steward of taxpayers' dollars, and I do not want to have somebody just sitting in an office. So it takes some thoughtful deliberation, some consideration, and the data will drive the work. So that's how I would like to do it.
I agree, it makes sense, but I do know that down Southgate, wherever downriver is almost as difficult for people to get to that are in western Wayne County as it is to come downtown to get services. So keep that in mind, that and I'm sure you will, that we need to make sure that we, and the numbers, like you said, should drive the process. But we need to, if we see that we can, there is enough need out
Roger
in
that.
Western Wayne that we get that as it was intended when we put the money in the budget. So,
Yes, sir.
thank you. That's all.
Thank you, Commissioner Baker McCormick.
Thank you, Mr. Chair. Just wanted to clarify, I don't know if that question was
Go
answered.
right ahead, madam.
The burial, 2018-19, there was not a number there. Is that a reason?
Bottom, go to the bottom.
So you just moved the category to the bottom, you're
Just to
saying?
answer the question, that's what this was pretty much generated for. So that's why we put it at the bottom, just to focus on it right there.
Okay, but it's not included in the itemized areas at the top. You see what I'm saying? At the top where you list clothing, all of the items, but when it gets to burial, is nothing there. So
Yeah.
I'm just clarifying that this number is
Is it? this-
just
is it-
omitted for some reason.
Yeah, I think we made the other spreadsheet just to focus on the bureaus at the bottom.
Okay, and then you just left it
Right,
off the top.
because we were collecting more data, and then we found out we found the numbers right there in that lower box.
Okay, all right. That explains that. Thank you.
So it shows it's approximately the same amount. Of course, it's burials, it's not something, we don't want a lot of those, but we do get them.
Okay, thank you.
And that's included in the $841,000 total then for 18-19?
Yes, sir.
So in this year's budget, your budget is for $905,000 to spend on these services?
Yes, sir.
How much upside, how much can you handle up? So let's say 1.3 million in requests come in. Can you handle that in your budget? How much over 900,000 are you able to handle?
Oh, I would say we're not able to handle an awful lot over that. I think we work with roughly 1.2 million, and there's admin fees that we have to use. And I think at that point, we probably trigger, can we tap into any additional monies, potentially surplus or something like that, to meet the needs of the veterans?
Well, I'll be curious in a few months here during budget discussions, how much requests you're actually getting,
Yes, sir.
and are you getting more requests than you're able to do in your budget? I'll be interested in that discussion at that time as we set your budget for the following year. Commissioner Baker McCormick.
And also, we talked about a report when we talk about the budget, how the numbers are broken down into district or by zip codes. I'll say it that way. How many people were serviced in, X area or, is there a way that we can get that continuously broke down that
Yes.
way?
Yep,
Yeah.
the
'Cause I think it
database
makes
allows
it-
us to do that. So if I pick a city, if it's Southgate, Kent, it tells me how many grants we awarded to those folks in that population. It goes based on the zip code.
Okay,
So that's doable.
great, because I think it will help each of us in knowing that our constituents in that area are being serviced, so.
And I think this is what we talked a little bit about at the start of this item. I'm going to be sitting down with Mr. Abbo in a couple of weeks here to talk about all of these kind of reports that come through budget instructions. And if we want to add zip code level data, so that once a year, when this report comes, we also get the zip code level. But let's wait for the budget instructions for that. But I think that's one way to handle that. So, any further questions on this receive and file item? Pleasure of the committee. Any additional questions? All in favor of the motion, please say aye. Aye. Opposed? Abstentions? Thank you so much for being here today. And
Sir, good seeing you.
It's great to hear what you're doing out there. Thank you. Madam Clerk.
Item 2, communication from Health, Human, and Veteran Services forwarding a letter of intent to resign from the Health Choice Board.
There you go. Anybody from administration want to talk to us here? Yeah. Hey. Names and titles for the record, please. Have some mic awareness so everybody can hear, including the tape.
Good afternoon and Happy New Year. I'm Janelle Allen, Chief Operating Officer with the County Executive's Office.
All right.
Good afternoon. Chris Johnson, Division Director for Access to Care and Executive Director of Health Choice of Michigan.
So the head of, well, I'm still behind, Health, Veterans, and Community Wellness. I'm still behind.
Health, Human, and Veteran Services.
Yeah, sure. I'll buy that.
HHVS.
That is, for our Health Choice Program, that position is one of the designated board members. So I don't know if the commission's been formally notified, but our Director of Health, Veterans, and Community Wellness is leaving the county, which also leaves this vacant. So I'll let you take it from there.
Okay. And I'll have Chris address any questions about the actual Health Choice Board, but I did want to come talk to you about just the general oversight while we're recruiting to fill the director of HHVS as well as the deputy director. But many of you may have heard already that Dave Brooks resigned. His last day was actually January 3rd. He chose to go he's pursuing his venture capital opportunity that he said he couldn't pass up. And while we're very disappointed that he was leaving, we certainly support him in his new endeavors. So now we are,
Appointed.
yes,
Hey, yeah, go ahead.
we are, but I will tell you that I actually welcome the opportunity now to work even closer with the department. Many of you may know that I'm very familiar with the department as I was here and was part of when the department was created, when the former Health and Human Services Department and Children and Family Services Department were merged into the one department, and then Veterans was brought over from the Seniors Department. So I was here doing that whole merger, as well as when we're establishing the overall org structure. And while I've been kept well apprised and informed of key areas and initiatives and projects over time, clearly I didn't want to get out of my lane and get in the director's lane. Now, though, I'm going to be overseeing the general oversight of the department while we are recruiting. And I actually welcome that opportunity, one, because it is near and dear to me, this department and all that is going on. And I will have little to absolutely no learning curve. I would tell you that I am very aware of all the key issues. This is letting me just get even a more direct view of some of the more, I would say, the minutiae, if you will, and to provide my own perspective and insight and how we can help continue to grow. I'll say, like in particular with Kwesi, was just speaking to you about veterans. There we clearly are talking about how important it is that we are getting far more out in the community with regard to outreach. And while we talked about just starting in Southgate, that is clearly just a pilot to begin. We know that we want to be well engrossed and involved across Wayne County, in particular in the Western Wayne County area. So Commissioner Anderson, we clearly understand your concern there, that we don't want our availability or our location to ever be a barrier to veterans getting our services. So we're also looking at just even better promotion, that someone doesn't have to physically perhaps come into an office. So we're looking at all of that. We can. I know there are other key areas. I know in one particular that I am really getting far more ingrained back again with jail medical. And I'm actually going to be taking a tour with our new Director of Clinical Services. We'll be touring the jail medical operations next week. So again, this is giving me an opportunity to get that much closer to the issues, which I am welcoming. And I will be available to respond to any questions you may have about the general oversight of the entire department's operations. But I will say, and I'm sure you all know from this committee and the